Hello, I'm Trudie Lobban and I'm founder of the Arrhythmia Alliance, the AF Association and STAR's Syncope Trust. Of course, many of us are discussing the new Covid-19 vaccine that's recently become available, and also the vaccines that hopefully will become available in the coming weeks. So I've invited two of our medical advisors to join me today to discuss the new vaccine, as I know many of us will have many questions. First of all, we have Dr. Matt Fay, who would like to introduce himself.
Hi, I'm Matt Fay. I'm a GP based in Bradford. I'm also a GP with an interest in cardiovascular disease and anticoagulation. And I'm lucky enough to be one of the trustees of AF Association, as well as one of the medical advisors.
And Sotiris.
Hi, I'm Sotiris Antoniou. I am a consultant pharmacist specialising in cardiovascular, and I'm also head of pharmacy at St Bartholomew's Hospital, one of the largest heart hospitals, and I'm also a medical advisor for the Atrial Fibrillation Association.
Thank you both for joining us. So of course, the big news this last week or so has been about the Pfizer vaccine. I wonder if we could start, perhaps Matt, with you as to who should be vaccinated against COVID-19 infection.
We're being told very directly in what order to vaccinate everybody for COVID-19. The ultimate goal is going to be that everybody who could have the vaccine will have the vaccine over the course of this vaccination program. But we're being structured into how we release it to make sure that those most at risk receive it first. So what is called cohort 1 is anybody over the age of 80 who is mobile, so can get to a vaccination centre. And they are the people who we are currently vaccinating. The hospitals, many sites went live just last week, and General Practice is going live today. And so we are working through that group. The next group will be frontline staff. So that will be NHS workers such as myself and Sotiris, as well as care workers. So if you're a paid carer working in a nursing home or in another care setting, you will be vaccinated, as well as the rest of the frontline NHS staff, are optometrists, dentists, pharmacists, of course. And then we'll work through a carefully selected program to do everybody at risk as quickly as we can.
And Sotiris, just how safe is the Pfizer vaccine?
I think what's really impressive is that there's been a multitude of vaccines coming through. Pfizer vaccine is just the first of many just being licensed, and it's pleasing to see this is licensed. I think it has been introduced and implemented quickly but safely, so that it has the same level of assurance as any vaccine. So it's gone through a clinical trial. I've done some evaluation looking at both the efficacy and the safety of the vaccine, and it was clearly deemed to be of value to the individuals to be vaccinated, recognising the consequences of COVID and trying to manage ourselves out of this pandemic. So without doubt, this vaccine is safe, and there are some caveats that I'm sure we'll come across, but ultimately for us as a population, this is a blessing, and we should welcome all the vaccines coming on board to ensure that we've got a multitude of vaccines available to treat the right individuals.
Could you just explain for our viewers what you mean by efficacy?
So when we're comparing any drug, or in this case a vaccination, they did an active arm where people were to receive this vaccine, and it's a 2-dose vaccine where they receive the first dose, and then after 21 days they get another booster, and this is in comparison to a control arm where they will receive a placebo, sort of a saline injection intramuscularly. And then what is shown to be in terms of efficacy is comparing that population to see how many of those picked up the COVID infection, whereas this drug was shown, or this vaccine was shown to be over 90% effective. And just to put that into context, the flu vaccine is approximately 40 to 70% effective. So it's really, really impressive that overall the population, over 90, I think it's 94% of the population shown efficacy in not receiving or not being able to get the COVID infection. So it's really, really impressive from an efficacy perspective as vaccines go. This is sort of unprecedented to get a 94% efficacy. As well as that, it's also been shown to be safe.
I think that's really important because we know about flu vaccines, etc. And a lot of people say, oh, it's only 94% effective. But if only they knew how much more effective it is than the regular flu vaccine, for example. So it's really good that you shared that information, because that's going to be even more reassuring for people. Are there any side effects?
No different from any intramuscular vaccine. So such as the flu vaccine, you're going to get some pain. You might get some headaches or some aches afterwards, but literally within 24 hours, most people will dissipate, and it's not as severe. It's certainly not as severe as getting the COVID infection. So it's worth doing as part of a standard vaccine, similar side effect profile, in particular around some aches and pains around the injection site in particular, perhaps because it's intramuscular, so it's going into the muscle. And then you might get a headache, which is probably the most common side effect that people have been reporting, but that is very much minor in relation to everything else in terms of the overall benefits that one will get.
We are being asked to make sure for this initial vaccine, the Pfizer vaccine, that people who have auto-injected adrenaline due to allergic reactions, they're not going to be included in this cohort, just because of a little concern that people might have reactions to it. So they'll need to wait for the next vaccine, which we're hoping will be out very soon.
Yeah, I mean, I know that really hit the headlines, that just 2 out of the tens of thousands that are being vaccinated had a severe allergic reaction, which I guess is the same with lots of vaccines, but right now this is headline news and it is very off-putting. So I guess the important thing, if you've been called to have a vaccine and you do have severe allergies, I'm sure you'll be asked about that at the centre, but also to volunteer that information for now.
I think that's why it's really, really important to recognise that there are another 2 vaccines literally within a week or 2 just behind it. So we will have an option for the vaccines to ensure it's the right one for you as an individual.
So one of those is the Oxford AstraZeneca we hear about, and the other one is
Moderna.
Moderna. And so hopefully, I mean, we're talking today on the 14th of December 2020, so we're hoping that within a couple of weeks, certainly by the end of the year, there's possibly 3 vaccines. So choice, will the patient have a decision in which vaccine they receive, or how will it be decided, on availability or how?
So the vaccines are discussed in the Joint Vaccine and Immunisation Committee, and they look at all vaccines. So any vaccine that you've received in the past will have gone through the same group. They determine in which order and in which vaccine we should be using in which group of patients. And that's part of their licensing, is to say that this is who we're going to be vaccinating. And all their information, their deliberations is all available on the internet. You just need to Google the committee and you can find exactly where you will fit and which vaccine you would be using.
And do you see that the COVID-19 vaccines being a bit like the flu vaccine, that you will have to have a vaccine annually going forward? How long do they expect?
Just before we go to that, just to say that there are some differences with the vaccines that might portray for a GP to have a certain vaccine or a community pharmacist, and that's really because the stability of the individual vaccines have a set period of time. So for big centres, as walk-in centres, they might be more suitable for the Pfizer vaccine because of stability's 5 days in the fridge, and that's why it's very much a sort of a one in, one out process, whereas community pharmacies might have another vaccine that has to be more stable in the fridge, in which case it'll be easier to ensure that everyone's vaccinated. In terms of how frequent they're going to have to get the vaccine, we're just going to have to wait and see. There are some thoughts that it might be every year vaccine that we're doing and seeing with the flu vaccine. It all depends on seeing how long we get immunised for and whether we need a subsequent booster every year, similar to the flu jab. I don't know if Matt has anything to add on that one.
Well, there's also now a question about whether or not combinations of the different type of vaccines may make a difference. So you may find that as the vaccination program continues, you have a dose of Pfizer followed by a dose of the Oxford vaccine. So things are very, very early on in how to make this even more efficacious than it currently is, and it's very efficacious as it is at the moment. The question, as Sotiris quite rightly highlights, is how long do we carry that immunity? Whereas with the flu vaccine, we get vaccinated with a different group of strains every year. There's a question about COVID-19, whether we might actually need to be vaccinated for the same strain every year, because we may shed that immunity over time. So lots of questions still, but what we know at the moment is that we have 1 licensed and 2 nearly licensed, very effective vaccines to try and get us out of this current global pandemic.
Yeah, there really is hope and light at the end of the tunnel. For somebody that's unfortunate enough to have had COVID, will they still need to be vaccinated?
Well, that's another interesting question, Trudie, because we know that as a species, we don't normally carry long-term resistance to coronaviruses. So this is why the common cold is such a common cold, is because as a species, we tend to lose that. What we don't know yet is whether being vaccinated against the coronavirus may give us a more lasting immunity, because we're not developing our resistance in the normal way. So whether you've had COVID or not, I was unfortunate enough to suffer COVID very early on in all this process, but I've continued to behave in a way to suggest that I might catch it again, because it's the safest way to go forward. So I've continued with my mask, I've continued with my hand washing, and I've continued giving people space, because it's important that I continue to protect myself and my family, of course, from me contracting the virus once again.
And we've had quite a few inquiries saying, you know, if I have the COVID-19 vaccine, do I still need to have the flu vaccine?
So it's really important, and what we've recommended, and there is some guidance, that we promote the flu vaccine, because that's is protecting us against the flu, which is different to COVID. And we know that you can have both vaccines, and the recommendation is a minimum of 7 days apart. And that's really just to ensure that you get a reaction to the flu where you might get a headache or sore throat for a couple of days. You want to make sure that that's cleared before you consider to have the COVID vaccine. But both are extremely safe, and it's really important to have it at least 7 days apart in accordance with the summary product characteristics, the license indications for the COVID vaccines, to ensure they've had the flu vaccine at least 7 days prior.
Now, on some of our forums, there's discussion back and forth saying that they're worried they're going to be ill if they do have the COVID vaccine because it's a live virus. And what about people with weakened immune systems, etc.? And should they be in a group that don't go ahead with the vaccine?
Live vaccines, we would not give to somebody with a suppressed immune system, particularly if that's due to chemotherapy or intervention by doctors. I would suggest that if you are in that group of patients, you should ask your specialist for their specific opinion about whether you should have the vaccine and which vaccine may be appropriate to you. These are generally quite complex medical issues that mean you can't be vaccinated due to low immunity, and almost everybody will be under a specialist. If you're somebody who's just prone to the more frequent infection, so you're somebody who tends to get every cold that comes to the office, that doesn't mean you've got a weakened immunity. That just means you're unlucky, and you may want to make yourself a little bit more lucky by getting vaccinated. But if you've got suppressed immunity due to intervention from doctors or due to illness, then you should speak to your specialist and get specific advice about your case and which vaccine may be suitable for you.
Now, turning to our patients with atrial fibrillation and that are being anticoagulated, many of them are highly concerned because of the risk of bleeding. How would you address that, someone being anticoagulated and needing a vaccine?
I think we recognise that this is an intramuscular injection. So with all intramuscular injections, there's an increased risk of bruising at the injection site. And we know that from concerns about the risk of hematoma. However, there's just been recent guidance from the NHS around saying that all COVID vaccines are safe for people who are receiving anticoagulants, and that's whether it's a DOAC or such as rivaroxaban, dabigatran or edoxaban, or with warfarin. And what we might want to do is just have, after the injection, is just some increased prolonged pressure, about 3 to 5 minutes, just to be applied to the injection site, and that will help reduce some of the bleeding. I think it might be a bit more considerations for people on warfarin, and that's really just to ensure that their INR is not above, say, 4. But if somebody said when they're about to have their injection, just take their yellow book, and it just might help ease to give them some confidence that their INR is within range. But we just need to recognise that there are concerns about bruising, but it does not negate the need of patients having the vaccine. It means that we just have to be mindful and just apply that additional pressure just to help mitigate against the bruising or the hematoma formation. And that's just due to some tissue injury or a puncture of a small blood vessels, nothing of any significance. So it is safe to administer to somebody who's on anticoagulants.
And if we think, Trudie, about the people, particularly with AF, who we anticoagulate because they are at high risk of AF-related stroke, it usually means that they're of a more senior age, or they have other cardiovascular illness, such as heart disease or diabetes, which puts them at a higher risk of having complications with COVID. So the fact that you're anticoagulated almost certainly highlights the fact that you are somebody who really should be vaccinated against this dreadful disease.
So as well as the vaccine not impacting on your anticoagulation, doesn't mean to say somebody should cease taking their anticoagulation medication the day before because they're going for a vaccine. So they should just continue with their medications. Are there any medications that contraindicate against the vaccine, whether that's for AF patients or any arrhythmia patients?
I'll just say one thing before Matt comes in, sorry Matt, and that's to say that we often do no longer discontinue anticoagulants for very many invasive procedures. So traditionally or historically, dental procedures we was always concerned, but now we know to not discontinue warfarin for things like dental procedures or endoscopies. So it is safe, it's not recommended to stop the night before, it's perfectly safe to continue as you would do normally before getting the vaccine.
That's what we've been telling our patients, but I know they would much prefer to hear it from the medical experts. Sorry, Matt, you were going to say.
I was going to say that if we move away from the anticoagulants and think of the other medicines that we use in heart rhythm disorders or in any cardiovascular disease, there's none of them which would preclude you having the vaccine, whether that be influenza vaccine or whether that be the COVID-19 vaccination. There's nothing that we use in regular cardiovascular practice that precludes vaccination.
That's good. So moving away from the vaccine slightly on the medical side, but some people are saying, well, once I've got the vaccine, does that mean I no longer need to wear my mask? I can have family round, I can just go back to normal, whatever normal is.
No, it is the short answer. The vaccine is part of our fight against this nasty bug. And part of it is trying to still reduce infection and spread. So we still need to think about our hands, our face and our space until we're seeing the infection rates really topple down. The vaccine hopefully is going to protect our NHS against being overwhelmed by this infection and hopefully save lives as we get to more and more people being vaccinated. So the spread of the virus has nowhere to go because everybody's vaccinated. But until we've got very high levels of vaccination, until we've got infection rates truly falling, we should continue to follow the public health advice. Keep in our bubble, keep our hands clean, cover our face when we're in enclosed areas, and give people social space. And that continues until we're told not to do that.
Yeah,
and I guess the only things to
there's nothing to say that we may have COVID on our hands and could pass it to somebody else or whatever. So it's still going to be, as you say, mask, distance, washing hands, even if you have the vaccine. Sotiris.
I was just going to say, I think now that there's a lot of talk about the vaccine, which is really to be welcomed, and having the vaccines is to be welcomed, there is the opportunity that we drop our guard. So it is really important to reiterate the importance of the public health message about keeping safe distance, wash your hands regularly and face masks. And that cannot be you know, we have to keep on saying that same message, because it's so important until the whole population has been vaccinated and we know it's completely safe.
And while we're here on the 14th of December and we're all looking forward to a Christmas, we've got to remember that this virus will not take Christmas off. And we still need to think of our frontline workers and make sure that we don't have a good couple of days of socialising and then put the whole of the NHS at risk come January because we've misbehaved and we've not washed our hands as much, we've not worn our masks, and we've had too many people round for dinner. So we need to keep vigilant, as Sotiris said.
Absolutely. So in summary, the vaccine obviously is welcomed. Hopefully as many people as possible will have access to the vaccine over the coming weeks and months. But at the end of the day, we still wash our hands, wear our masks, keep our distance until we know that the virus is almost extinct, if you like. I think people of all ages must remember that, and not because you've been vaccinated are you in an exclusive group. Are there any other messages you'd like to give the audience about the vaccine or about COVID-19 in general?
My message is, as I say to many of my patients, is remember that a lot of what we're doing at the minute is about looking after other people, making sure we don't spread the virus between groups of people. But the person who is very important is yourself, and look after yourself. And that's not only your physical health, but your mental health. Remember to reach out to people and talk, even if you can't touch them. Remember to look after and enjoy your life while this is going on, because it's so easy to become so isolated and so lonely with all this going on. So reach out to others. Even though you can't touch them, at least you can talk to them.
Absolutely.
I'll just reiterate the mental well-being with all of this. I think this has changed people's lives, and we have got technology where there's Zoom, and don't be afraid to touch in with your loved ones just over Zoom is a safe way, recognizing that this has had more impact than many people have ever imagined. And whilst we talk a lot about physical well-being, the mental well-being is equally as important, and we're starting to recognize that a lot more, which is great. But hopefully just keep touching base with people and making sure if you need support, there are support networks out there, as well as the AFA, just as a point of contact for people around support.
Absolutely, and we have our online forums, but most importantly, we have our helpline for Arrhythmia Alliance, for the AF Association, and for STARS. And so, as well as keeping in touch with family and friends, please, the number will appear on the screen. Do not hesitate to contact us at any time, and we will get back to you if our line's busy, but we always try to answer. It's, as we've always known, it's good to talk, and hopefully one day soon it'll be good to be together again. But in the meantime, Matt and Sotiris, thank you so much. I know how busy you are. On behalf of all the patients, thank you for everything you're doing as frontline workers, and especially for giving your time today to provide information and answer some really general questions that can bring so much reassurance to everyone. Thank you both.
Pleasure.
Pleasure.